Today, we are diving into a treatment that looked like a miracle for some of the world's most vulnerable patients. But what happens when the cure might carry its own hidden costs? That's the really tough, controversial question we're exploring. You know, for premature infants, born fighting for their lives, every single breath they take is a monumental battle. And for the doctors trying to help them, finding a way to win that battle, well, that's everything. So, to really understand this whole controversy, we first have to get a handle on the life-threatening condition doctors are up against. It's called PPHN. Okay, so what is PPHN? It's basically a crisis that happens the moment a baby is born. Their whole circulatory system is supposed to make this massive switch to start breathing air. But with PPHN, that switch fails. The blood vessels in the lungs just stay clamped shut, which causes the blood pressure in there to skyrocket, and it starves the baby's entire body of oxygen. And the stakes here could not be higher. The mortality rate for PPHN is just staggering, somewhere between 10 and 50%. For these tiny infants, this is an immediate life-or-death emergency. So, faced with this incredible danger, the medical community found what seemed like the perfect solution, a treatment called inhaled nitric oxide, or NOI for short. The theory behind it was just beautiful. People thought of NOI as a smart key. It wasn't some sledgehammer drug that affected the whole body. It was a precision tool. It was designed to go right to the source of the problem and unlock those blood vessels in the lungs, and absolutely nowhere else. The way it worked was just so elegant. An infant inhales the gas, it goes straight into the lungs, and right on contact, it relaxes those constricted blood vessels, which immediately improves oxygen flow. Then, and this was the really genius part, it gets neutralized almost instantly in the bloodstream, which prevents dangerous side effects in the rest of the body. I mean, it really seemed like a perfect solution. But in medicine, a beautiful theory is, well, it's just the beginning. The real question is always, does it actually work when you put it to the test? And this is where our investigation really kicks off. This brings us right to the heart of the matter. For the smallest, most premature, and most fragile infants, does this amazing smart key actually live up to its promise? Okay, so let's look at the evidence. Our first big clue is a landmark Cochrane review from 2017. Now, these reviews are pretty much the gold standard in evidence-based medicine, and this one looked at 17 different trials. And the findings were a shock. The review found that NOI did not significantly reduce deaths or chronic lung disease. But even more alarming, it suggested that the treatment might actually increase the risk of serious neurological problems. I mean, this was a devastating verdict against the treatment. But hold on, the case wasn't closed. As more research came out, the plot really started to thicken, with other major studies coming to very, very different conclusions. So let's look at our second clue, a different meta-analysis. This one was published in 2023, and it looked at the data from 11 trials in a whole new light. And this analysis, it just completely contradicted the earlier review. Now, it also found no overall survival benefit, but it discovered something huge, a significant reduction in chronic lung disease. Plus, it found no increased risk of severe brain injury. All of a sudden, the treatment was back on the table. And that 2023 study, it also revealed a really critical detail. The benefit wasn't across the board. A significant reduction in lung disease was only seen at higher doses of NOI. This suggested that, hey, maybe the dose makes all the difference. But the story takes one more twist. Our third clue is an even more recent and larger analysis from 2025, which pulled together data from 31 different trials. So this latest piece of evidence, it added another layer of complexity. It confirmed the good news about lung health, which is great, but it flagged a totally new concern, an increased risk of retinopathy, a really serious eye disease that can cause blindness in premature infants. So you solve one problem, only to maybe replace it with another. So what in the world do you do with all this conflicting evidence? This brings us right to the heart of the matter for clinicians on the front lines. This is the doctor's dilemma. Think about it. Doctors are facing an almost impossible choice. On one side, there's the chance to prevent a lifelong lung disease. But on the other, they risk causing brain or eye damage. And there's no guarantee the treatment will even save the baby's life. It's a true medical tightrope walk. And this quote from one of the studies, it just says it all. This isn't just some academic debate. It's a deeply controversial and unsettled issue right now, today, in neonatal intensive care units all over the world. So how do we navigate this kind of uncertainty? Well, this is where we see how medicine has to operate in these really difficult gray areas. Out there in the real world, NOI is not a routine therapy. It's kept in reserve as a compassionate tool, basically a last resort for the sickest infants when nothing else is working. And its use is surrounded by caution. A definitive diagnosis with an echocardiogram is essential, and parents have to be fully informed of all this deep uncertainty before they give consent. So you see, in the end, there is no simple yes or no answer here. The verdict is a complex, agonizing, case-by-case balancing act of potential hope against potential harm for each and every child. This whole story really reveals a fundamental challenge at the heart of medical progress, and it leaves us with one last, really big question. In all of medicine's gray areas, how do we balance our desperate hope for a cure with the immense and often contradictory weight of the evidence?